The Capstone program in Nutrition and Dietetics is a critical step towards becoming a registered dietitian, nutritionist, or RDN. This program bridges the gap between theoretical knowledge and real-world practice. It requires 250 hours of supervised experiential learning. Students apply their knowledge in various clinical settings. They develop essential skills under the guidance of experienced preceptors. The Capstone experience culminates in a practice test. This test assesses the student's readiness for independent practice. It covers a wide range of topics. These include the nutrition care process, or NCP, evidence-based practice, client-centered care, and more. Acing the Capstone practice test requires a thorough understanding of key concepts. Students must demonstrate their ability to apply these concepts to real-life scenarios. This essay will guide you through the essential elements of the Capstone program. It will help you prepare for the practice test and excel in your future career. The journey to becoming an RDN is challenging but rewarding. The Capstone program equips you with the knowledge, skills, and confidence to make a real difference in people's lives. Embrace this learning experience and strive to become a competent and compassionate nutrition professional. The Nutrition Care Process, or NCP, is a systematic framework. It guides RDNs in providing individualized nutrition care. The NCP consists of 4 distinct steps: assessment, diagnosis, intervention, and monitoring evaluation. Assessment involves gathering relevant information about the client. This includes their medical history, dietary habits, and lifestyle factors. It helps the RDN to understand the client's nutritional status. Diagnosis identifies the specific nutrition-related problems. These problems are based on the assessment data. The diagnosis provides a clear focus for the intervention. Intervention involves developing and implementing a tailored nutrition care plan. The plan addresses the identified nutrition diagnoses. It may include dietary modifications, education, or counseling. Monitoring/evaluation assesses the effectiveness of the intervention. It determines if the client's goals are being met. Adjustments are made to the care plan as needed. The NCP is a dynamic and iterative process. It ensures that nutrition care is patient-centered. It also ensures that care is evidence-based. Evidence-based practice is crucial in nutrition care. It involves using the best available scientific evidence to guide clinical decisions. This ensures that interventions are effective and safe. RDNs critically evaluate research studies. They consider the study design, sample size, and statistical significance. This helps them determine the reliability and applicability of the findings. Translating research into practice involves integrating scientific evidence with clinical expertise. RDNs also consider the client's values and preferences. Evidence-based practice is a continuous learning process. RDNs stay updated on the latest research. They attend conferences, read scientific journals, and participate in professional development activities. By embracing evidence-based practice, RDNs provide the highest quality of care. They help clients achieve their health goals based on the most current scientific understanding. Client-centered care is fundamental to effective nutrition practice. It involves placing the client at the center of the care process. It respects their values, preferences, and needs. Building a strong therapeutic relationship is crucial. This involves active listening, empathy, and open communication. It creates a safe space for clients to share their concerns and goals. RDNs empower clients to make informed decisions about their health. They provide evidence-based information. They present it in a clear and understandable manner. Cultural competence is essential in client-centered care. RDNs respect the diversity of food practices and beliefs. They tailor their recommendations to be culturally sensitive and relevant. Client-centered care fosters a collaborative partnership between the RDN and the client. It leads to better treatment adherence and improved health outcomes. Section 5. Assessment in nutrition practice, gathering the facts. Assessment is the foundation of the nutrition care process. It involves collecting comprehensive information about the client's nutritional status. Registered dietitian nutritionists use various methods to gather this information. Dietary assessment tools include the 24-hour dietary recall, and the Food Frequency Questionnaire. The 24-hour recall captures detailed information about the client's food intake over the past day. The Food Frequency Questionnaire provides insights into usual dietary patterns over a longer period. Anthropometric measurements such as height, weight and body mass index provide objective data on the client's body composition. These measurements help assess growth, nutritional status and risk for chronic diseases. Biochemical data obtained from blood or urine tests offer insights into nutrient levels and metabolic processes. These tests can detect deficiencies, excesses or imbalances that may impact health. Clinical assessment involves observing the client's physical appearance, medical history and lifestyle factors to identify potential nutrition-related problems. By using a combination of assessment methods, RDNs obtain a holistic view of the client's nutritional status. This comprehensive assessment guides the development of an individualized care plan. Section 6. Dietary Interventions, Tailoring Nutrition Plans for Success. Dietary interventions are a cornerstone of nutrition care. They involve developing and implementing personalized nutrition plans. These plans address the client's specific needs and goals. Registered dietitian nutritionists consider the client's medical history, dietary preferences, and lifestyle factors when designing interventions. They use evidence-based guidelines to ensure that the plan is safe, effective, and culturally appropriate. Dietary interventions may involve modifying macronutrient intake, such as adjusting carbohydrates, protein, or fats to manage conditions like diabetes or heart disease. They may also focus on increasing the consumption of specific micronutrients, such as iron or calcium, to address deficiencies. RDNs provide education and counseling to empower clients to make sustainable lifestyle changes. They teach clients about portion control, label reading, and healthy cooking techniques. They also address any barriers to change and provide ongoing support and motivation. The goal of dietary interventions is to improve the client's health outcomes by optimizing their nutritional intake and promoting healthy eating habits. Section 7. Cultural Competence. Respecting diversity in dietary choices. Cultural competence is essential in nutrition practice. It involves recognizing and respecting the diversity of food practices, beliefs and values among individuals from different cultural backgrounds. Registered dietitian nutritionists strive to understand the cultural significance of food beyond its nutritional value. They recognize that food plays a vital role in social gatherings, religious practices, and family traditions. When providing dietary guidance, RDNs consider the client's cultural preferences and tailor their recommendations accordingly. They avoid making judgments or imposing their own beliefs on clients. RDNs use culturally appropriate communication styles and materials. They ensure that language barriers do not hinder effective communication and understanding. By embracing cultural competence, RDNs create a respectful and inclusive environment for all clients. They empower individuals to make informed decisions about their dietary choices while honoring their cultural heritage. Section 8. Conclusion. Practical skills for a rewarding career. The Capstone program provides aspiring registered dietitian nutritionists with invaluable practical skills. These skills are essential for success in this rewarding career. Students develop strong communication skills. They learn to effectively convey complex information to clients, families, and other healthcare professionals. They master active listening, empathy, and counseling techniques. Problem-solving skills are honed through real-world case studies and clinical experiences. Students learn to critically analyze situations, identify nutrition-related problems, and develop evidence-based solutions. Interpersonal skills are crucial for collaborating effectively with other healthcare providers. RDNs work as part of interdisciplinary teams to provide comprehensive patient care. The Capstone program prepares graduates to confidently enter the workforce as competent and compassionate nutrition professionals. They are equipped with the knowledge, skills, and experience to make a meaningful difference in the lives of individuals and communities.